If you ever feel pain on the outside of your knee that somehow feels tied to tightness in the side of the leg and up in the hip that also worsens when moving your knee into certain positions, then you're just like Jackie here, and here's what we did. When she didn't have any pain with full straightening or full bending, it was pretty likely she didn't have a meniscus issue. But what she did have was extremely limited hip internal rotation on the side that was painful compared to the side that was not painful. And when you add that lack of internal rotation to the fact that she was extremely weak in the muscles of the hip of the painful side, and when pushing through the IT band she felt extreme pain, then it can only be one thing. It's the classic prolonged IT band syndrome where the main presentation of pain is along the outside of the knee. To start, I did some manual therapy techniques to restore that hip internal rotation, and I used some other manual therapy techniques to help reduce the tension that she was feeling in the tensor fascia lata, which is the main muscular attachment to the IT band. And I also made sure to work the outside of the quad, which can also feel very tight when IT band pain syndrome is present. After that, I started her with just 3 exercises today, the first one being this one to help increase her mobility into hip internal rotation, along with this exercise where she's doing a straight leg raise with it turned into internal rotation as much as she can to make sure that she's working that tensor fascia lata. If you're tight and weak into internal rotation, this tensor fascia lata will always be upset. And finally, I added this exercise to help address the weakness that she has in the other muscles of the hip.